Live breaking news from your local news channel.
Thanks for joining us for this News Channel special report. I'm Beth Farnsworth. Santa Barbara County is holding its weekly briefing on the COVID-19 pandemic. Let's listen in.
On the county's website and YouTube page shortly after we conclude the press conference. The recent COVID-19 outbreak in the sorority and fraternity houses in Isla Vista, along with the cases that continue to occur in all parts of the county, will likely prevent us from meeting the less restrictive orange tier criteria on the state's report card next Tuesday. Under the governor's color-coded system, the county must meet the orange tier criteria for 2 consecutive weeks before moving from the red to the orange tier. The COVID-19 outbreak in Isla Vista appeared to be initially contained, and the residents have all been quarantined. Unfortunately, additional testing now shows the outbreak was not contained within the residents of the affected sorority and fraternity. Several dozen additional cases have now been identified through testing and contact tracing. Isolation and quarantine efforts are underway in cooperation with UCSB officials. Public Health is working now to confirm the number of new cases. An innocently intended gathering can lead to an outbreak. A small outbreak can quickly spread in a dense community to become widespread community transmission. Cooperation with contact tracing is vital to identifying other individuals who need testing so the contact tracing process can stop the spread of the virus. Testing, contact tracing, isolation, and quarantine are the actions required to respond to an outbreak. The much more effective strategy is to prevent an outbreak from occurring in the first place. If the residents involved in the parties that started this outbreak had been more responsible and considered the potential consequences of their actions, this could have been avoided entirely. UCSB, Santa Barbara City College, and county public health officials are sending a joint letter to all UCSB and City College students reminding them about the critical importance of complying with the county's public health order and reminding them about the consequences they face for failing to comply with the orders, which could include suspension and expulsion from school. Isla Vista property owners must show greater responsibility for the health of their tenants and must enforce restrictions on gatherings. The letter is the latest in a cooperative multi-agency outreach effort to increase mask-wearing compliance and eliminate gatherings in Isla Vista and throughout Santa Barbara County. As a reminder, the 5 new cases identified yesterday in Isla Vista were not the highest count in the county on that day. Unfortunately, 6 new cases reported in Lompoc yesterday, and Santa Maria had the highest number of cases in the county earlier in the week. There is so much at stake right now. The prospect of a second wave of the virus spreading through our community must be avoided because lives are at stake. Our kids need to be able to get back to school. We need to be able to visit our frail elderly relatives and friends in nursing homes. Local businesses must have the opportunity to fully reopen so lost jobs in our local economy can recover. In order to accomplish these goals together, we all have to continue to do our part to reduce the spread of the virus in our community. This message applies to young residents in Isla Vista. It applies equally to couples who want to gather with friends over wine in the San Ynez Valley. It applies equally to friends who want to have a backyard potluck in Santa Barbara, Goleta. It applies equally to extended family that want to celebrate a birthday in Santa Maria. This year, to be safe, we can't gather together the way we've always done it in the past. We can and must keep our relationships intact and flourishing by being creative and innovative. Yesterday, I saw a bride and groom at the county courthouse wearing masks while taking their wedding photos. It was a beautiful sight, and it reminded me of the incredible creativity and resiliency of our community. That bride and groom might forget the date of their wedding, but they're never going to forget that this is the pandemic year that they were married. Make time to call friends and family on the phone. We're all extraordinarily busy adapting to the new demands of our remote lives. Screen time dominates our daily interactions. Take a moment to turn off the distractions and reach out to a friend or family member to simply stay in touch. The circumstances we currently find ourselves in isn't permanent, but it also is going to be with us well into the next year. Halloween is right around the corner, and the event is another test for our community. Please follow the Public Health Department guidance and don't take your children out trick-or-treating door to door. There are far too many things that can go wrong, and the consequences, particularly at this fragile moment, are extraordinarily momentous. This past Tuesday, the Board of Supervisors approved an administrative ordinance to provide additional enforcement tools to assist in managing the COVID-19 pandemic. This new administrative ordinance does not change the county's fundamental enforcement strategy, which is founded on education and cooperation. The new ordinance applies to the unincorporated area of Santa Barbara County and authorizes administrative fines of $100, $200, and $500 for egregious and willful violations of the public health orders. This new enforcement tool was created to add a graduated response to existing enforcement efforts. The vast majority of individuals and businesses that have been reported for violations quickly resolve those issues cooperatively, but this new administrative fine will encourage compliance with someone who's not willing to cooperate. The Public Health Department will be hosting a free flu shot clinic at Curation Foods in Guadalupe on November 12th from 2 to 6 p.m. Just show up. There's no need to make an appointment. You will not be asked for identification or insurance information. The Santa Barbara Better Together Fund, a partnership between the Santa Barbara Foundation, County of Santa Barbara, and numerous other community organizations, will be accepting business grant applications until next Wednesday, October 28th. Eligible businesses in the unincorporated area of Santa Barbara County can receive up to $7,500 per grant to assist them in safely reopening. The County of Santa Barbara is committed to supporting our local small businesses during this challenging time. For more information, please visit sbfoundation.org. Next, we have Dr. Vonda Reynoso, the Director of the County's Department of Public Health.
Thank you, Supervisor Hart. Like all counties throughout California, we are guided here in Santa Barbara County in our overall response by the Governor's Office and by the California State Department of Public Health. We must follow their guidelines, and as I've noted before, we can be more, but not less, restrictive in our local approach to addressing the virus. The blueprint for a safer economy is one example of the state's strategies in addressing the virus. While other states are currently experiencing surges in the coronavirus cases, California continues to hold steady given our metered, dimmer approach strategy to reopening. This strategy, coupled with state and local communications regarding masking and social distancing and our community response, has made a difference. California is in a far better place than it was several months ago, and we, as a county, following the reopening guidelines, and yes, making several more restrictive decisions, such as restricting gatherings and increasing testing beyond the state average, have netted reductions in our case rates and testing positivity. Thank you to all community members who have given so much and heeded the advice of public health and other medical experts. 14 states recently set records for the number of patients needing to be hospitalized, but California's hospitalizations have declined, as Santa Barbara County, reaching a low of 12 last week. So too have the state's cases decreased. In California, the 7-day rolling average number of confirmed cases peaked in July with more than 10,000 and have since dropped to approximately 2,700 as of October 19th. The state's daily case rate has dropped from a high of 26 in July to 7.5 as of October 21st. Similarly, here in Santa Barbara County, our daily case rates have also dropped from 26 to 5 per 100,000 population. In addition, another contributor to our recent case reductions as a county is our continued testing, as we have averaged nearly 300 daily tests per 100,000 population over the last several weeks, exceeding the state median testing parameters of 239. The rate of California's positive tests have dropped from a summer high of 9.8 to now 3.2. That's approximately half the national average. Here in Santa Barbara County, our current testing positivity rate is 1.9%. So let's review the metrics for Blueprint for a Safer Economy in total. Here's where we currently stand. Our daily case rate is fluctuating in the range of 4.5 to 4.9 from October 11th to October 14th, and the testing positivity rate continues to trend downward, ranging from 2.1% to 2.4% during the same time period. In order for us to move into the less restrictive orange tier, we need to decrease our daily adjusted case rate to 1 to 3.9 per 100,000, or no more than 17 for our county. The orange tier is within our grasp. We're almost there if we only can work on decreasing our case rate. Other counties have been able to move towards the less restrictive tiers. So we urge everyone to do your part to decrease the transmission of COVID-19 in our county. Please wear your face covering, maintain physical distance, wash your hands, sanitize surfaces that are frequently touched, and limit gathering to others outside your household. I'd like to update you on the increased cases we are experiencing in Isla Vista and the potential impacts. We currently have 34 active cases in Isla Vista. We have expanded our testing capacity in IV. We've been offering testing since 10 a.m. this morning and will continue to test tomorrow. We will have additional testing at the IV Theater next week on Thursday, the 29th, through Saturday, the 31st. Our third testing event is on Thursday, November 5th, through Saturday, November 7th. We are looking at additional days for the next testing event as well. We do anticipate additional cases in the IV community and will provide those on our website. In addition, UCSB has notified the county that they are continuing to experience positive cases among students through their testing. UCSB will be directly reporting this to the public and the media. County Public Health cannot report on the cases until we have confirmed lab tests reported to us within the system. Therefore, our numbers may lag a day or two behind UCSB's direct case positivity reporting. We are, however, in daily coordination with UCSB on all aspects of the response. For reference, cases reported during the week of October 18th through the 24th will be considered as part of our state metrics during the reporting period on November 3rd. I've been asked if the IV increases, will it have an impact on our tier status? The answer is that if our collective county case rates at any period result in a higher than 7 cases per 100,000 per day, or 32 cases for our county, we may be reassigned to the more restrictive tier, the purple tier. I would also like to let you know that guidance from the state has been updated for several key sectors. This includes new or expanded guidance for movie theaters, family entertainment centers, personal care services, hair salons, and barber shops, among the few. Updates can be found at the state website, covid19.ca.gov, industry-guidance, as well as on our county at readysbc.org. Lastly, Halloween is next Saturday, and we are concerned that we will see an uptick in new cases from 1 to 2 weeks after Halloween due to gatherings and celebrations. No one should be participating in the traditional trick-or-treating this year in the traditional ways. You can find new ways of celebrating, observing Halloween on our website at publichealthsbc.org. At all times, please take care of yourself and protect others around you by being diligent to wear your mask when you are outside your home, by maintaining at least 6 feet from others, and by limiting gatherings with others outside your home. Thank you.
Thank you, Dr. De Reynoso. We'll now go to questions from the room. Mr. Devine.
Hi, so first question for me, you said 34 active cases in Isla Vista. Can you give me an estimate of how many of those were as a result of those gatherings that took place?
It's hard to say, but we can tell you that we are investigating and monitoring outbreaks at 5 fraternity and sorority homes, as well as investigating the new batch of cases that we just recently received.
Kind of speaking along, Greg was talking about it, but just tell me, we're so close to the orange tier, if I'm not mistaken. What does something like this do to our potential to get into the orange tier, but could also kick us back into the purple tier, correct?
Right. So as I mentioned, the cases for the tier assignment is taken collectively. And so the increase in cases will definitely have an effect because it's collectively adding to the daily number of cases allowed in the orange tier, as well as maintaining the red tier, as well as moving us backwards to the purple tier.
And what would be your message to those young students that are living in Isla Vista with just the effect that they can have on businesses and other things reopening?
Right. So as Supervisor Hart mentioned, we are concerned, and we do believe that the majority of the Isla Vista community are adhering. So we are sending out a letter, an open letter signed by Dr. Ansorg, as well as Dr. Polito, as well as the president of SBCC, in really spelling out the consequences of not adhering to our prevention messages, as well as encouraging everyone to adhere to the basics, the face covering, the social distancing, and the no gathering.
And when will this letter be sent out?
I believe it's in the process of being sent.
Okay. And you said suspensions could happen or expulsions as well?
Yes, so UCSB has been discussing those consequences with the student population.
Okay. And then prior to this outbreak, were we set to have numbers putting us potentially in the orange tier this Tuesday?
I think that we were very, very close. We were on the edge.
But now we don't really know what could happen.
We're solidly in the red still.
Okay. Makes sense. All right. Well, thank you.
Thank you, Mr. Devine. We'll now answer questions on the phone.
Yes, we're going to Malia Martin with Santa Maria Sun. Malia, your mic is open. Go ahead.
Thank you. So what would you say to people who point to the state's low hospitalization rates as a sign that, we should have less restrictions and more reopening? Would you say the downward trend is an indication we're ready to reopen, or rather is it a sign that we should continue to stay vigilant in our restrictions?
I would say that it is really good that our hospitalization rates are going down, but we need to be mindful of the increasing cases, because the increasing cases may impact the vulnerable population, the family members in our community. And we are not ready to throw open the gates just because based on one metric, the hospitalization. We have to really examine the case rate and the testing positivity.
Thanks so much.
Thank you, Ms. Martin.
And that concludes our Q&A.
The Board of Supervisors did not have a scheduled meeting next Tuesday. Would you see?
Actually, we have a
Okay.
latecomer. We're going to Fabiola Navarrete. Sorry for interrupting.
No, sorry. It was my fault. Okay, thank you. Good afternoon. I just wanted to know if you could repeat the numbers, please, Supervisor Hart, about how many new cases did you find in Santa Maria? You just said the highest number was in Santa Maria, but I couldn't hear the exactly amount. Sorry.
I was just putting the information from Isla Vista into context. I think it's easy for folks to point to this outbreak in Isla Vista, but just wanted to remind people that when you look at the course of the week, There are larger number of cases that have occurred in Lompoc as compared to Isla Vista, and in Santa Maria as compared to Isla Vista over the course of this week. So it's not a situation where Isla Vista alone is the only problem that we have. You know, there are issues throughout the county that continue, and I think it serves as a reminder for everyone to be cautious and vigilant and attentive to wearing masks and washing your hands and keeping physical distance wherever you live, work, or recreate in the county.
Oh, okay, thank you so much. And one more question. This is about the new updates about the guidance for some of the business. Is this, of course, I'm sure that, is this because they are going to be more restricted to avoid the spread, or what kind of new updates?
Actually, the guidance is an attempt to clarify what is required. It is a cleanup, if you will, of the different sectors. Before, for example, movie theaters were clumped into family entertainment centers, and now it's in its own guidance with clear language around how to support a safe and clean environment for workers and customers.
Oh, okay, thank you. That's all. Thank you.
Thank you,
Thank
Ms.
you,
Navarrete.
Fabiola. Now that does conclude our Q&A.
The Board of Supervisors does not have a scheduled meeting next Tuesday. The Public Health Department will send out a press release next Tuesday announcing the county's newest weekly state report card status. We will also have a press conference next week, but the date and time have not been scheduled yet. If you have any questions, please call the 211 information line. Local information on COVID-19 and access to support and services is available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work. Isolate yourself, call your doctor or medical clinic, and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We are stronger together, safely apart.
Okay, Santa Barbara County Public Health updating the community. 34 active cases of COVID linked to fraternity sorority parties in Isla Vista will keep Santa Barbara County in the red. We'll have more on this coming up in just a moment. Stay with us.
Stay with your news channel for breaking news updates on air and on all your devices.